Hey everybody, my name is Dr. Hedeen and this is Nicola. Nicola supposedly has back pain today, so we're going to go over what maybe a first back treatment might look like and with the evaluation as well. So usually after I've kind of watched the patient kind of moved around, kind of done some exercises and some ruling out some matters, I'll just kind of come in here and work with the ball and socket joints and kind of see how they move, how that circumduction movement feels. We can get in here and kind of feel certain areas of tissue. So for Nicola, we can see that it's a little tight in here.
Yes,
it's a little tight. All those squats, right? We can come in here, we kind of feel other areas of range of motion. Again, right now, I'm just trying to see what the range of motion feels like, where there might be restrictions. I can come down here and check her feet out. We can work at the knees. We can basically evaluate a number of things just in this supine position here. Again, here I'm also looking for symmetry. Does each hip joint move the same as the other? How one might differentiate, how she might compensate in other manners. Here, Nicola, I just want you to breathe normally, inhaling and exhaling. From here, we can kind of decide and understand where she might be putting pressure or where her diaphragm might be pushing into, whatever part of the abdominal wall it might be. People with low back pain might have a difficult time initiating in certain parts of the abdominal wall when it comes to breathing, when it comes to using that diaphragmatic pressure efficiently. Again, we've talked about in the past, poor diaphragm activity will generally lead to concavities in the abdominal wall and more or less just overall back pain or back aches. All right, so from the evaluation, we kind of found both hips being pretty tight. And so what I'm going to do is stack her hips, and then I'm going to work that motion of the pelvis translating over the ball joint in a closed chain position. The overall goal of this exercise is to get more eccentric lengthening of basically the back part of the booty and even in the inner thigh muscle, kind of recalibrating the overall hip joint. So from here, Nicola, you're going to resist me as I roll towards you. So you're resisting, nice and, but let me win. Good. And then from here, you're going to roll back into me. So you're opening. Again, from here, we're just working the hip and resist. Happy hips, happy low back. If you have tight hips, something has to move more, and oftentimes that puts more stress on the back. Let's roll open, open, and light resistance. Again, we're creating better synergy at the overall hip joint and all the muscles that surround the pelvis. Go again, open up, keep breathing here into the abdominal wall and resist as we roll back over. And Nicola will tell you that she feels a stretch in the back part of the hip / buttock area. Yeah. It may be down to the IT band. Good. All right, so from here, we're just putting more rotation to the spine. This exercise is really great for kind of people that have tightness in the low back. Being in this position might be challenging for some people because it doesn't allow, they might not be able to translate or rotate in all three motions of the spine. So from here, I got Nicola in this position where she's able to have her hip opened up. And if we wanted to make it more of an active exercise, we can have her lower the knee, bring her butt up, and just hold here. Shoulder blades back, chin tuck, breathe. Again, we're always trying to get a better married relationship between the abdominal wall and that hip. Resist me as I push down here. Resist. Good, come back down. And just come back up. We can overstress that hip. Again, we're always coming back to the abdominal wall, the low back, and that hip. From here, come back up. Good. We're gonna be here, you're just breathing. So this exercise, now I'm trying to create a better relationship between the knee and the abdominal wall, okay? We're breathing. Let's bring the hip back down nice and slow. Again, we got the hip, knee, abdominal wall, all working together. Now we're gonna try opening up that hip even more. We're gonna rotate over my thumb. Good. We're open back up. Closing. Again, we're working that translation of the pelvis over the ball joint in a closed state position versus just normally just stretching her on her back. One more time here. All right, to help out with some soft tissue mobilization, what we're going to do is we're going to have to put some cups on the back here. Again, this is going to help out with maybe any sort of soft tissue restriction, bring some blood flow to the area, and make the overall, maybe the adjustment happen more simple or less forceful. And I'll just leave these on for a few minutes, kind of again getting some blood flow to the area, moving the tissue, kind of get that fascia, that connective tissue to just mobilize. Obviously part of any treatment, we'll always want to make sure that we're getting good mobility in the spine, so an adjustment tends to be a good effective way. Right here, rolling over. Good. Gotcha. Give that a little breath, and all out. All right, from here, Nicola, what I want you to do is pressing your shins into the table, meet my resistance. Try not to extend too much around here a little bit. Other way. Good. Meet right. Good. Right there. Perfect. Now resist my pressure. Again, we're thinking about breathing into the abdominal wall, breathing into the thighs. This is going to help distract the overall spine. From here, we can see a good abdominal wall. Just thinking long. Again, so let me win a little bit. Let me bring you back. Good. And now come forward. Again, we can work that overall range of motion at the hips through hip flexion without compromising the abdominal wall. Good. So this whole exercise, here, tuck your tail a little bit for me, right there, good. You breathe your bit back, just a little bit, okay? We've been talking about breathing, getting this abdominal wall activated. We've worked on exercising the hip and the knee in a married relationship with the pelvis. Now we're gonna get her to load her foot and kind of tie the whole chain together. So from here, this is good exercise, getting the foot right underneath the hip, okay? Challenging this whole entire left side of the body, okay? Shoulder it back. Again, she's focused on breathing and expanding this abdominal wall. And so honestly, this position right here is just walking. So we're basically taking a moment of time. And so if you have back pain while you're walking, okay, we take a moment of time and kind of create good synergy between the hip, the knee, and the foot, adding the abdominal wall in and freezing yourself in a moment of time. Breathe. And obviously, the longer you hold on to this, you'll start to fatigue and compromise in certain areas. So we just gotta keep cueing until we get a good loading pattern. And from here, we're just trying to get a good stretch to this QL, some good passive motion.
So that is our treatment. It's so awesome. So do not forget to subscribe so you can see more videos and learn more about your body. Give us a thumbs up if you like this video. And if you have any questions, always DM us. Have a great day.